Hey everyone, and welcome to another video. My name is Lenora Edwards, and I am a board-certified speech language pathologist with Better Speech. Today, we're going to be talking about autism, signs and symptoms of delayed language, and how speech therapy services can help your little one. Stay tuned.
Hey there! Before we get into today's video content, I want to go ahead and remind you to subscribe to our channel, Better Speech. And after you watch the video, if you found it helpful, go ahead and click that like button, comment down below, and don't forget to share with your family and friends. Also, visit us at betterspeech.com for more information. Now, over to the video.
So the first thing to understand is that when it comes to autism, also known as autism spectrum disorder, this is a broad range of conditions ranging from difficulty with social skills, ranging from difficulty with communication, and ranging from difficulty with repetitive behaviors. It's also truly important to understand that the medical community, as they indicate autism or autism spectrum disorder, may indicate this as a disability or a disorder. It's important to be respectful of the individual who is experiencing autism or diagnosed with autism. And it's also important to be respectful of their families, as they often consider themselves neurodiverse, indicating that they simply learn differently. There is not one type of autism, but many subtypes, most influenced by a combination of genetic factors and by a combination of environmental factors. Now, that being said, each individual has their strengths and has their difficulties, just like you and I. Each person learns, thinks, and problem solves in their own way, and they range from highly skilled to needing more support. And sometimes that support may be 24-hour care, and other times that support may also be in the form of a communication device. Remembering that this is a broad range and that individuals are approached as individuals and not as a collective. Each care plan that a clinician comes up with when working with an individual with autism is tailored specifically to them. You can often see signs and symptoms of autism in young children as early as the age of 2 or 3. But it's also important to understand that signs of autism can also develop at the school age and even later in life. It is not uncommon for adults to be diagnosed with autism as they are in adulthood and moving throughout their life. Signs and symptoms vary very widely, and it each truly depends on the individual. Now, remembering that language is two parts. We have the receptive component of language, which is everything you are doing as the listener. You're receiving information, you're processing information. That is the receptive component of language. Also, reading is the receptive component of language. Then we have the expressive component of language. Everything that I'm doing as I'm talking and producing sentences, that is the expression of language. Also, writing is the expression of language. Now, individuals with communication difficulties that are diagnosed with autism have difficulties in one or more of these areas. This can present as difficulty understanding directions. This can present as difficulty understanding conversation or difficulty understanding when questions are asked of them. This can also present as difficulty using their words, or they have the development of words and then they lose their words. This can also present as difficulty expressing themselves in sentence form. There truly is a wide range. Now, in this video, we are going to show you a screenshot of signs and symptoms that may indicate your little one is at risk for autism. Now, it's important to understand that these are guidelines. These are markers that we look for in typical development. And if your little one is not meeting these markers in typical development, it is absolutely warranted that you consult a medical professional for further evaluation. If you have concerns at any point, or if you notice a shift in their language development or in their development at all, or a delay in their development, trust your instincts and absolutely reach out to a medical provider for a formal evaluation. That is truly the most important thing to remember. Now, as a speech language pathologist, our role is to assess your child. Our role is to assess your loved one who presents with difficulty communicating. Now, that can look very, very different, as I have mentioned already. But what we do is we come in with you. We meet you where you are, and we meet your child or your loved one where they are. We are looking for certain things indicating where their strengths are, and we are looking for certain things on where their difficulties are, and also where we would like them to go. Our intention for therapy is to help them communicate easily and effectively in the way that is best suited for them. At times, this may indicate that if your child is not verbally showing any desire or any ability to express themselves with their articulators, that's okay. A device may be recommended, but it's truly important to remember that a device is there as a support and as a way to empower that individual so they can effectively communicate. Now that we talked a little bit about language development and the delays that may indicate signs and symptoms of autism, let's talk a little bit more about social skills. Individuals with autism may have difficulty in social settings. So, what exactly does that look like? That looks like they may have difficulty introducing themselves and entering a group of people. This may also look like difficulty knowing when to laugh appropriately or when to have the appropriate emotional read, such as they may have difficulty understanding the expression on your face. This may also look like difficulty maintaining the topic of conversation or closing the conversation. This is where a speech language pathologist also comes in. We work with individuals understanding social communication, which includes body movements, which includes body expression, which includes facial expression. We also work with individuals on this so that when they are in social settings, they know how to effectively communicate and they can also feel more confident and competent in their skills. One more thing to add is that individuals experiencing autism may have difficulty chewing and swallowing. And as a speech language pathologist, we also work with individuals on this skill. It's important for them to be able to chew their food safely and to transfer it safely and to swallow it safely. If you have concerns that your little one is experiencing difficulty chewing or swallowing food, absolutely reach out to medical professionals to ensure your child's safety. You are also welcome to reach out to us at Better Speech, where we will do our very best to offer you more guidance and support. That's it for now. Thank you so much for watching this video. We truly hope that you have a better understanding of autism and the difficulties that individuals may experience when it comes to communication and when it comes to social skills, but also even when it comes to swallowing. So thank you so much for your time. As always, if you have any questions, please don't hesitate to reach out to us at Better Speech. We offer a complimentary consultation where we will do our very best to answer any and all of your questions and to offer you and your family more guidance from there. Till next time, stay well, and we'll see you soon.